Good afternoon. And today I have a pleasure of interviewing my neighbor, Dr. Berman, who is a dentist for the last 35 years or 40 years?
39.
39 years. And we actually not just neighbors, we are collaborators.
Yes.
Good afternoon, doctor.
It is a pleasure to speak with you and educate people out there about dental sleep medicine.
Yeah. You are the first dentist who I interview on my channel on a topic of collaboration between dental sleep medicine and dentist. So I hope this interview going to be interesting for people who are trying to build this collaboration, to my colleagues, and also to the dentists who thinking to protect the restoration while working with dental sleep medicine, but also overcome the anxiety of losing their own patients. We're going to talk about those, I would say, gray areas, what's not so illuminated. And even in my articles, I did not, write even one article. I'm very hot on the topic collaboration between physicians and dental sleep medicine, but dentist is a little bit different story. But we're also going to talk about challenges, not only challenges of the collaboration, but challenges in the field. What to do when patients have oral appliance, but you need to do the restorations, you need to put the implant, and veneers, cosmetic treatment, how you approach it without sweat on your back. And we have a relationship, we co-treating the patient. So I hope my audience can learn from that, from that collaboration. And also idea for dentists who looking to integrate air-focused treatment into their practice, but not so sure how to do that, and how to they can do it or not do it, or what should they do. So my first question to you, when you first learn what your patients also have a dentist actually next door who is working on them, what was your idea, or how you respond to that? How did you feel?
Sure. So to be very transparent, I have two patients right now that we share, and they've been longtime patients of mine, and I've built up a relationship with them over the years. So I'm very confident in myself and my relationship with my patients. They have issues with sleep apnea, and it's above and beyond my knowledge base. And I want to help them holistically, their entire, it's not just their teeth, it's, their medical status, anything that I can possibly do. And this is not an area that I am knowledgeable about. So my trust in my relationship with my patients does not affect me referring a patient to somebody who can help them in an area that I can't. And sleep medicine is an area I am not knowledgeable enough on. And I'm going to use the expression, I stay in my own lane. I don't treat people for that. I'm not going to take a weekend course or read a book on it and try to be, what little I can, because I'm only going to hurt them in the long run. So when I have a patient who needs this and they're seeing you, you are a resource. You know so much about this. And it's not like you took a course over the weekend. Your expertise and your knowledge base is second to none. And, I teach 1 day a week in the dental school. And what you're doing is not something that is really taught to the dental students. And the only thing I think that dentists and dental students should know is when to refer to a specialist. It's no different than any other specialty. Stay in your lane, refer to somebody that knows what they're doing. And when it comes to sleep medicine, I have a lot of respect for you. We sat down for a certain long amount of time, and you just basically explained things to me and made me more knowledgeable on an area I really didn't know. And nowadays, so many people are being diagnosed by the medical field. And I say that by the medical field, not by the dental field, because sleep apnea is a medical condition, not a dental condition. And for a dentist to say that they've diagnosed somebody with it, to me, you should run fast away from them.
Mhm.
So when a medical doctor diagnoses somebody with one of the types of sleep apnea, and there's more than one type, by the way, I wholeheartedly can't wait to refer them to somebody, my neighbor, who is my resource, my encyclopedia, who can help my patient.
Thank you. That was a lot of kind words. I really appreciate that. But my point, what as a dentist, and I see, in my, part of my practice, what is not dental sleep medicine, people who don't have official referral from medical doctor, but, just in a patient population, first of all, as a dentist, we see a lot of signs of sleep apnea, problem with temporomandibular joint, bruxism, torice, big area of bone growth, signs of acid reflux, obstructions, crowded airway. So, patient cannot breathe through the nose, and patient have a trouble even going through the dental procedure because, they have a lot of refluxes. That's also, related to this area of dental sleep medicine. So we have such a close proximity to all these signs, and a lot of our patients have a CPAP machine what's standing in a closet, and they complain about that, or spouse said my husband snore and I heard dentist can help. And then I think, yes, it takes certain courage to do the exploration and look for help for that patient, but I'm going to tell you the benefit of that. Your restorations can be saved with oral appliance, because oral appliance gonna protect them and patient not gonna get upset. I think
100%.
that's very important thing, because a lot of patients, when they have, crown on tooth number 7 and tooth number 7 get broken, I'm talking about specific things what related to significant load, what patient put on a teeth when they cannot breathe, and they can be very frustrating for the dentist and very frustrating for the patient. So patient might leave for that reason. And if you do something else and you refer and you try to help patients, dentists cannot diagnose. But in my office, if dentists need resources, we're going to provide resources. We're going to provide the medical community I have connection with, and patient get help, and patient will be returned back to the dentist. That's very important, because every patient have a relationship with the dentist. Is not, patient and the dentist is a very precious relationship, and I don't want to be in the middle of that. No way.
100% agree. And, you talk about with, with the bite and things, I'm going to make an analogy. We've both had patients who've had open heart surgery or valve replaced. And what happens is the cardiac surgeon, cardiologist will send the patient over before the surgery and say, please do an evaluation, make sure there's no problems, whatever, for in this case, any infections or any broken teeth, anything that needs to be done. So now fast forward this to sleep medicine. I almost think before an appliance is fabricated, because they're not cheap, that the sleep medicine doctor should have a dentist evaluate everything, because if a tooth looks like it needs to be crowned or they want to do veneers, the time to do it is before the appliance is made. Now, granted, things happen, and I've had it happen with me with one of the patients where they ended up needing a crown. They broke a tooth afterwards, and I had to make a crown. And I didn't know until I had a conversation with you the right sequence of doing things. Had I known that, it would have saved a lot of aggravation in planning things in advance. And that's one thing that I think is very important that could save some aggravation for the patient, so you don't have to make a new appliance, which obviously is not cheap, that you can plan accordingly moving forward.
No, it's a wonderful point you made. I really appreciate that. And I want to say a couple comments. A lot of dentists, I work with several dentists, in a collaborative care of their patient, and they ask me that question. How, things happen. Patients have appliance. It's a medical condition. And I have to address the medical condition because I have a referral from the physician. And yes, it's true. You mentioned about dental health. It's very important. I check all dental health, and I mentioned about a lot of things to the patient. Periodontal health is number one that I want to be addressed as soon as possible. Restorative work I also mentioned, but it's a little bit challenging to complete it in a time frame what I have to finish with appliance. Like going back to your story. But when I see the broken tooth or patient tell me I'm gonna have implants here, it's an empty area, I digitally open up the space for ideal restoration. I understand about implants. Implants go where we have a bone, but restoration have to go in a place where they belong. And there are some modifications, it's true, but most of the time, patient will have a model, and patient have a model in their possession. After they get appliance, they also have a digital model of the mouth as it is,
it presents.
Is present in a moment when I fabricate the appliance. And they have to use that model either with digital scan and created, version for the lab, or they can take impression. They can do a lot of things to create exact shape or smaller shape of the restoration, what it will fit to the appliance. They cannot do anything bigger than existing form, what they present originally. Truth is, some appliances I can modify, especially if patient gonna have aesthetic case. I can work with anterior teeth and I can modify the appliance, especially if appliance made from acrylic. But if appliance made from silicone, 3D printed, for bruxers, then that's not possible. And to prevent that aggravation, it's very important to have a great communication between restorative dentists and dental sleep medicine. But we can benefit from those relationships. I want to finish that conversation because when I check periodontal health and restorative health, I make recommendations and I beg patient to go back to the dentist. And very often I send dentist a letter. This patient needs 3 months recall. This patient needs periodontal therapy because this is the foundation for my appliance. And restoratively, they have to be healthy. This patient needs a crown. I recommend, as well as in the process of treatment, if I see anything broken, again, I recommend to the dentist. So from this relationship, patient can benefit and dentist can benefit as well.
It's a team concept. And I think, what you started out earlier with the collaboration and, I would say some dentists may fear that by sending a patient to you, that you will then take over everything and they won't see the patient again. And, that might be some concerns that some dentists have, but it's really, in at least my relationship with you, it's unfounded because we're a team. And we're all there trying to treat the patient and help them out. When I send a patient, for argument's sake, for periodontal surgery, okay, and the periodontist does the surgery, they come back to me for the cleanings, and we alternate because it's not about being, having an ego or being selfish. It's about doing the right thing for the patient. And that's what you have to put first and foremost is what's best for the patient. You brought up before something about CPAP machines.
Yes.
That, since meeting and discussing with you and having patients going to you, I've become a little more knowledgeable in having conversations. And I have yet to find one patient that's happy with their CPAP machine. It's impossible. They hate it. Many don't even want to wear it. And, they say to me sometimes, yeah, I wish I could have an appliance, but my insurance won't cover it because they paid for the CPAP already, something like that. So, and I say, you got to go talk to the doctor because that's not my area of expertise. I don't know the codes. I don't know what insurance does with that because it's out of my lane. So I appreciate
this is
you.
fantastic comment. I really appreciate what you brought it up. Yes, it's true. A lot of dentists are aware about the patients who sleep or don't sleep with the CPAP and patient concern about insurance. So as a general rule for any patient, if patient has a Medicare and patient try the CPAP and they don't like it, they have to return it before 90 days expired. So, sitting in a closet and collecting the dust, if you know yourself, usually with the CPAP machine, yes, 1 day is not enough, but you try, you change several masks. And usually it's a nasal breathing issue, which we address, of course, when we do oral appliance therapy, of course, and with collaboration with the ENT. But if you already try several masks and it's still collecting the dust in your closet, return it. Because then it's become true for after 90 days, insurance says now, or Medicare specifically, you bound to that for 5 years.
Right. And I understand that, it's, they have a window. And then if that's the case and they're not wearing it, then it's totally out of pocket, for
the patient.
client.
Yes.
Yeah.
But another thing for the dentists who, I know you don't want to explore and, do oral appliance therapy. But I work with the dentists who are interested in doing oral appliance therapy for the patient. And I would be delighted, I would be happy to help them to do oral appliance therapy for their patient who they can, with the physician, of course, make agreement as fee for service because they might not want to have a team and deal with the medical insurance. But if patient adamant about insurance coverage, I would be delighted to help and do oral appliance and protect the sleep and make them patient more energetic, but in the same time to protect the dental restorations. And I think it can be very beneficial for dentists to have experience and work with oral appliance if they're willing to.
Right.
But if they not willing to deal with insurance, then I would be happy to help. So it can work on a different scenarios. And of course, a relationship in any collaboration is everything. And, that's why I really appreciate what we have such a direct line through the text and through the phone calls, like in case of any misunderstanding, because I'm here to help your patients, not to take any patients. I have patients.
I've seen that. And I've seen that because the patients that I've sent to you have been strictly there for their sleep issue, and they come back to me for their regular treatment, and there's no issue there. That thought process of that you would possibly even deal with that is not even on the table, and I appreciate your honesty and how you've educated me and also educated the patients. I think if a patient's educated on what you're doing, why you're doing it, you have a better chance of a higher success with something like that.
No, that's very, very, very important to me because, of course, I have to make sure dentist is happy, but also very important, I have to make sure patient happy and physician is happy. And those relationship, I think those are such a precious relationship, and it's very hard to accomplish or to find people you trust. So I want to keep it as intact as possible. But in the same time, if a patient has an issue, I want to make sure I let you know what I want that to be done and that to be done. It's very important.
And it's interesting because, the patient, I can only go by the patients I've sent you. And since I've developed a relationship for them for many, many years, sometimes they may feel more comfortable saying something to me than saying it to you. And we had that happen, and I
We had
discussed
that
it with you,
happen.
and
Yes.
it was wonderful. And we got better results. It,
Yeah.
it was a win-win for everybody. And my patient came back and said to me, I really appreciate you talking to Dr. Sokolina because it really made a difference. So kudos to you on
Thank
that.
you. No, actually, in that, I had a conversation with my friend yesterday who really was upset what her doctors don't communicate. So patients always appreciate when doctors communicate and they form the team, not one doctor do as a silo that and he's the best in, I don't know, heart, and then they don't talk to primary care or they don't talk to ENT because that's, yes, really, it's one connected body. No, especially, between us, dental sleep medicine and teeth, they're not too far. So I really hope with, this interview, it can open the doors to collaboration, and dentists maybe open the eyes or have a
100%.
different lens and look for sleep apnea patients in their practice, because it can really save a lot of aggravation with the broken restorations and, with a lot of, longevity issues, a lot of precious things, what when I address the sleep, they can, have a better life.
There's more people out there that have sleep apnea problems. And I know that there's different types of sleep apnea, and not all are amenable to appliance therapy.
No.
And I think that's one of the issues sometimes, where you have a dentist who thinks, and I say thinks, that they could, like a one size fits all, we'll make an appliance and that'll solve it. But without that medical diagnosis on the type of sleep apnea, it's really doing the patient an injustice.
No, but it's the Dr. Berman sent me wonderful article about malpractice case, what dentists overcome, scope of practice and did the diagnosis. But it's a first rule in the dental sleep medicine, what we cannot diagnose sleep apnea, and we always work in a collaboration with the physician, because physicians have to do the diagnosis. Yes, about one size fits all, it doesn't exist, of course. And it's a very custom treatment, oral appliance therapy, because in most of the cases I do it not only with never I do it only with oral appliance. It's always oral appliance and then nasal therapy. I make people breathe through the nose, but now a lot of times not I combine it. That's not I do that, but I recommend patient nutritional counseling. I recommend talking to GLP-1 providers, either endocrinologists, cardiologists. A lot of different specialists now have obesity board certification. So that's combination of treatment. And a lot of time it's combination between CPAP and oral appliance, because life is dynamic and we have a different stages, and sometimes people want to combine these two treatments. Like, for Medicare patient, it's also possible, but they have to have one therapy and then another therapy in 5 years. But sometimes insurance can have both. People who have certain insurances, they can have both therapy, and they combine CPAP for certain situation and oral appliance for other situation. So that exists in my practice. And then we use Inspire therapy, and I work in a close collaboration with the ENT when they can help nose to make nose more usable. And allergologist. So, on my channel, I always put a different ways how we can approach the sleep. So I really appreciate what now I can bring, my field, dentists, into that team, and we can do it together, because dentists can do a lot of things in combination with dental sleep medicine.
I agree. Thank you.
Thank you very much, doctor. I really appreciate your time.
It was a pleasure, and thank you for educating me on something I really didn't know enough about. And I'm still learning, and I appreciate your patience in teaching me.